Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo, and we're not alone today. Joined on the phone by a special guest, Dr. Terry Raymar. Lynn, why are we speaking with Dr. Raymar today?
Well, Dr. Raymar makes a repeat appearance on the show to talk to us about prevention of type 2 diabetes, which is super important to this community.
Wow.
And as we all know, he's recently retired from UHS, but family practice is his training and diabetes is his passion. And there's a lot of, I think, new ways of looking at it. So I'm excited to hear what he says. Welcome, Dr. Raymar.
Thanks for having me.
Yeah.
I enjoy talking about diabetes prevention. That's my favorite topic.
Well, Lord knows we need it. So just before we went on the air, you said that prevention starts in the womb. And I was
correct.
surprised to hear that. What can you tell us about that?
Yeah. Well, so it turns out that, without getting too wonky and technical, that the environment that the baby is exposed to can determine how the baby's physiology is set up for the rest of their life. So if you're exposed to either high blood sugars or a stressful intrauterine environment, both of those things can have changes in your system that result in changes that can put you at increased risk for type 2 diabetes, just very simply stated. Without, again, getting too scientific or wonky about it. But it's very clear. There's a lot of good data. It was interesting. They were just talking about the Dutch hunger winter on the radio yesterday, when many mothers during World War II were deprived of food on the siege of part of Holland. And so those children were at higher risk for diabetes and cardiovascular disease and a number of other problems. But so it starts in the womb. And so what we want to do is provide the most healthy intrauterine environment possible. And that means if a woman is discovered to have gestational diabetes, that we treat that very well and carefully with good education and providing good information. If needed, medications, not always needed. But also trying to have a good, healthy environment for the baby in other ways. If the mother has high blood pressure, that needs to be treated. If the mother lives in a stressful environment or food deprived, those things, we want those remedied. So
Absolutely.
Any of those things can result in increased risk through the youth of the child. Actually, that risk starts in the teen years, really starting around puberty.
Right.
So it really puts them at increased risk at an early age. And if you combine that with any other potential for type 2 diabetes, environment, maybe some familial, this kind of gets off a little bit, but type 2 diabetes, some people look at it as perhaps familial or genetic. I don't really look at it that way. I don't think genes are destiny. I think most of our genetic makeup is very well attuned to live in a certain environment. But if you don't have that environment, it can cause health risks.
Absolutely.
So I really don't think of diabetes as a genetic problem. It's more a mismatch in your personal makeup and the environment that we're in.
So we have more control over it than what you're saying. Absolutely.
Genetics is not destiny. That's what I like to say. So
great.
Yeah.
That's exciting. So I start to see kids with high sugars and kind of when their weight bounces up as they're, in their teen years, especially if they're more sedentary and maybe indulging a little bit more in junk food and stuff. But some people here in Del Norte actually, places here are kind of food deserts, and it really is hard to get healthy food. So is that what you're talking about? And kind of when teens start to, their weight goes up and they get some insulin resistance. What can you tell us about that?
Yeah, that's kind of the second phase of problems after the womb, and that starts, with toddlers and such and how they're being fed. And, it becomes a very sort of complex problem that I'd like to distill a little bit to something that makes sense, in that when we're fed certain foods, it may change our microbiome, the way our bacteria and our hormones in our gut speak to other organs in our body.
Uh-huh.
This is not well understood yet, but it's starting to be better understood. And so if we are feeding people sort of natural foods, that unprocessed foods, things that are, that your great grandmother would have eaten and recognized,
Right.
Sort of what we call the outside of the store, where there's produce and those kinds of things, that kind of sets up a more healthy microbiome that may decrease the risk for developing an increased body mass index. So it's not just as simple as, they ate too much or that kind of thing, or not active enough, but
Right.
certainly activity is a big part of it. And we try to counsel people about screen time. That's not just adults, but kids too,
Mm-hmm.
and get them out and active. And sometimes people don't feel that there's a safe environment for their kids, so it's a little bit challenging.
Yeah.
But the most that you can do in that regard is setting those things up very early in the child's life, so there gets to be an example for them, and it develops as part of their life. I know for me, it was interesting. My dad was a little different. He loved to play tennis, and he started running before it was ever popular. And I had this example in my life of being physically active that I thought, oh, that's something I'm supposed to be doing. And so we want adults to not just tell their kids to be active, but be active with their kids. So it's a kind of a win-win, right? Because the parent becomes more active, and that's healthy for them as well. So as you alluded to, activity and foods are very important in regards to diabetes. But going back to the early stages, even breastfeeding has been shown to help prevent diabetes, say in the teen and 20 years. So what we feed our children early on can make a difference, and breastfeeding. And I don't know what the magic time is, but the longer you breastfeed, the better the benefit. So up to, 2 to 4 years. But even, I think the minimum amount you want to see is about 6 months to get some benefit for prevention of diseases and other things too, like ear infections and those kinds of things.
Absolutely.
Are decreased
Yeah.
by breastfeeding.
I know from my practice, a lot of the Native moms are very dedicated to breastfeeding, and it's not always super easy. But there's a lot of support in the community for them. So so you're
good.
saying that's actually prevention for those babies,
Yes.
Probably for the moms.
Surprisingly, yeah.
Yeah.
I think there is some benefit to the mothers in the 5 years after, if they had gestational diabetes and they breastfeed. There is some additional benefit there. That's a statistic I don't really have at the end of my fingertips, but my recollection of that is beneficial. But there's so many other benefits that I wouldn't focus on that much. It's a really healthy thing to do for the child and for the relationship with the child and the mom.
Awesome. All right. So then what happens by the time? So if we get through adolescence and people are, hopefully this is a baby that didn't have too much exposure in the womb, has a good microbiome, was breastfed, and then has continued good habits within the family, and they go away to school, or, they start young adulthood in some form, and, they're kind of taking care of themselves, and maybe what would you suggest for a young adult that's just starting out to help minimize their risk?
Great question. So we want to promote a good both combination of resistive exercises and cardiovascular, or what we call those aerobic exercises. Even just, and I shouldn't use the word exercise, but rather activity. You want to stay aerobically active, and so that can be just as simple as walking. But if you like things like, if you like, rowing, or taking a canoe out, or jogging or biking, any of those kind of things, and they can be culturally appropriate. We had some folks up on the Klamath working on learning traditional paddling. So those kinds of things. Those are aerobic activities. Those repeated
And dancing.
low
I
impact.
imagine dancing. Yeah.
Yeah, dancing would be a wonderful aerobic activity.
Mhm.
That's a good one to bring in there. So we want people to stay active. The magic number is around 150 minutes a week, but more is better.
Mhm.
And this will help set up a physiology, if it's maintained, that is more receptive to taking glucose up into the muscle cells without that additional having to need a lot of extra insulin around that sort of puts that workload on the pancreas. So if we were to get into kind of like some of the wonky stuff about it, when we eat a lot of carbohydrates, that puts a lot of work on our bodies to put out insulin and to try to store that away. But by being physically active, we uptake those carbohydrates more naturally. The muscle takes them up without insulin. Mm-hmm. That's the only two ways to get the sugar fuel into our muscles, is by either moving or having insulin. That's the only two ways that sugar gets in those cells.
Uh-huh.
So it's the activity is really important. And then how we continue to eat through adulthood, because you can be fed really healthy when you're younger, right? Mm-hmm. And then you go off to, say, college, and you're busy, and you might be relying more on fast foods and those kinds of things, right. Which on occasion aren't going to be too detrimental, but the more you can eat, again, foods that your great-great-grandparents might have recognized, unprocessed foods as much as possible, and get an even balance of, you want to have good lean protein, can really help satiate the appetite, help your feel satisfied. A little bit of fat is okay and can also help that feeling of satiety. Proteins really seem to be better at that. And then moderate your carbohydrates again, and especially try to higher things with higher fiber, like whole grains and that sort of thing. Wild rice, those kinds of things, rather than the processed foods.
Do you have any data on timing, like how to link exercise in your day to what you've eaten, or is that kind of too new? I think we're finding that out. Yeah.
Yeah, there's been some data. There was some recent information on that, mm-hmm. and I try not to get too much off on that, because what it may get a person thinking, oh, if I didn't exercise in the morning, then it's not going to do me any good to exercise in the afternoon. It turns out that morning exercise, I believe the recent study showed that there was a little bit of increased benefit in taking up the glucose relative. But this is in people who already have diabetes.
Oh, okay.
So for who don't have diabetes, I think the important message is just to try to be physically active as much as you can, and in the time of day when you feel comfortable. If you can get up early in the morning and do it, if you can get that in the later afternoon, great. One thing that I think is pretty clear, you don't want to do aerobic activity right before bedtime, because it can interfere with your sleep.
Okay.
And that brings up another important factor that we're learning about, in that not having good sleep is probably also a long-term risk factor for developing diabetes. Not quite as well worked out, but it's certainly a health issue. If people aren't getting that 7 hours a night of good, healthy sleep, mm-hmm. that sets them up for all sorts of metabolic abnormalities. So sleep is a really important factor for people.
So that even carries through in people who are like shift workers or something? I mean,
Yeah,
that'd
unfortunately,
be,
they have, yeah, that they're at a little higher risk for those things because
right.
of that. And
Hmm.
so trying to figure out how to work your shift work and uh, be preventative, it can be challenging for people, but there's ways you can cycle. I mean, you can work with your workplace, so that you're not always on the same
Hmm.
shift that
Hmm.
you alternate, and that sort of thing. Maybe go through month cycles and that sort of thing. But yeah, there's always going to be people who have to do shift work, right? I remember, my
Yes.
residency, we had to work in
Yeah.
the emergency room and those kind of things,
Oh,
and I
absolutely. Yeah.
certainly wasn't following my own advice then.
Yeah. Well, yeah. Yeah, my daughter works the night shift on the floor at a tertiary care medical center as a nurse, and I've noticed that she's gaining a little bit of weight, so she'll so advise her. Um,
Thanks, Mom.
yeah,
What is
I'm sure I'll hear about
Doctor, it seems like so much of what you're talking about is I mean, you talk about the growing understanding of the microbiome, and how it's kind of tied in with it seems to be tied in with just about every system in the human body. The same with sleep. It seems as if the overarching message here isn't so much of like maybe an old school medical thing where medicine can solve all these problems, but it's if you can live a balanced life within certain parameters that kind of come naturally to you, that's probably the greatest benefit you can get health wise, kind of across the board.
Yeah, you just perfectly stated what I was trying to get across by saying a whole bunch of words, and you said it all in one beautiful little statement. So that's exactly correct. If you think about all these things, they're kind of common sense. It's kind of like the stuff you're, well, in our days, my mom might have said to me, or my grandma, eat your vegetables.
Right, right.
it.
Get to bed at a regular time. Don't stay
Right,
up late.
right. Go
Those
out and
kinds of.
play. I heard that a lot.
Go
Yeah, go out and
on.
play.
Yeah,
Yeah, I noticed that kids don't seem to go out and play like they used to. I mean, when my mom had to be yelling at us to come in, when it was dark,
Right.
but kids don't do that so much
right.
anymore. So
No,
Yeah.
no, that's really sad. That's something I remember doing too. You stayed out until the street lights came on, and all of those cliches you see online nowadays. It was true, and you didn't want to go inside. I'm curious though if there's also about what you're outlining here and living in this sort of commonsensical space. There's a lot of privilege wrapped up with that, isn't that? I mean, you've got the ability to sort of I can order my work times. I have the money to buy the healthier foods, or I live in a place where those options are even
Right.
physically there for me. It seems also that kind of the socioeconomic bracket that you live in could impact your health very, very much in this regard.
well, it's not just that, but also your historical background. Interestingly, Paul.
Yeah.
So
Well.
it's really that you bring that into the fore, because people who have been exposed to traumas, you may be familiar with the term of adverse childhood experiences.
Uh-huh. Yeah, the
These,
aces. Yeah.
yeah, the ACEs. When people have multiple of those, this puts them at higher risk for diseases like diabetes and such. And of course, being in a socioeconomically deprived situation, not having the means for these things, it certainly does increase your risk. And that's a really challenging thing to deal with. But I don't think it should stand in the way of us discussing with our patients these things in a very positive way, because even with people with limited means, if there's a concern and a willingness, there are things to work around that. For instance, the high price of foods. If you have the time and are willing to do a little bit of food preparation. I know, like, when I'm really busy, what I do is I prepare my meals on Sunday evening for some of the rest of the week, and try to cook, beans and that sort of thing, and have vegetables all ready to go, at night, so I can just throw them in a pot or whatever, so that there are things you can talk with your patients about. So you don't want to be too
You don't want to be preachy. You don't want to say, "Oh, you're doing it wrong,"
Yeah.
right? Yeah.
Yeah.
Right. Absolutely. Yeah. You want to just come with a positive message and not a despairing message like, oh, well, you don't have the money to buy good food. So, well, you're out of luck. No, there are ways we can work around those to some degree. It's still a challenge, and I don't want to diminish it, but it's another thing that's very kind of sort of disturbing about our society, that we have a greater and greater economic disparities between those who have and those who don't, and that's probably a discussion for another day. But
Right.
Your points are very, very well taken. There's so many things that go into this. It's not just a matter of eat better and try to get a little exercise in. That's not gonna cut it for full diabetes prevention, but you have to be mindful of all these things. And speaking of mindfulness, that's another thing. If you can work with your patients, if they do have stressful environments, doing mindfulness activities, breathing exercises, whatever your choice is, they all seem to have some benefit. But that too can help, if you have a stressful environment, doing that kind of thing when you can.
Terry, can I jump in here and say a little bit about resources local to Del Norte? You know that UHS Wednesday night has at the Fred Endert pool that the UHS patients can go down there and swim. And they have a water aerobics class or laps or just individual hanging around on the water kind of time. It starts at 7, I think, and ends at 8:15. All you have to do is write your name on a piece of paper if you're a UHS patient. Our pool here is great, and it's available to people outside the UHS system too.
And it's free for them those evenings? Free for UIHS patients? Or is it discounted?
I think it's paid
No,
for.
it's free.
Nice.
It's free to the patient and paid for by grant money.
That's great.
I expect.
Yeah, this is sponsored by the diabetes program. Yeah.
Oh, wow, good.
That's sponsored
Oh,
by
you
it.
did that? Oh, great. You do know about
Yeah,
it.
yeah.
Yeah. Super.
Yeah. Oh, yeah. I
Last
that's in our
summer-
budget.
Yeah, last summer it was the happening thing to do on Wednesday night in Crescent City. It was well received. We also have hiking and biking up here. We have a bowling alley that's functional. We have trucks that go out to various sites that provide fruits and vegetables for they're kind of at the Native American clinics, but you don't have to be Native necessarily to participate in this. And we also have the food forest where you can go in and you can harvest fruits and vegetables. And I would connect with the Patient Resource Center to talk about our Family Resource Center.
Yeah.
On Pacific there. So we have a lot of great resources in this community. We just have to get the word out.
And again, that kind of goes back to what Dr. Raymer's been saying too, just here recently in this, is that it's a mindful way to live and to plan, and you have to be conscious about this, because the default in our society is kind of fat and lazy. And you have to kind of be purposeful about it, I mean, the commercials on TV, they want you to eat the bad stuff. They want you to,
Right.
to be less active. It seems like they may say something else, but they're presenting it in such a fashion that it seems to lend itself toward a more sedentary interpretation. So you have to go out of your way, it seems like.
Yeah. And the fact is, the food companies are very savvy about this. They've learned what can make foods hyper palatable. This is a term that that they make them taste very good and very accessible. And those are probably the least healthy foods that we could be eating, because they're usually what's called ultra processed. And they know what they're doing. So we have to kind of say, are we going to let the companies, dictate our health, or are we going to take some agency here? And it does take a little more thoughtfulness and a little more work, but it can be done even on a lower budget. And I don't want to get too prescriptive in exactly how you would do that, but because that's an individual thing. Every person would want to work with either, if they're in our patient population, nutritionist, or maybe go online for resources for that. But anyway.
Yeah, I'm a big fan of the Blue Zone and the DASH diet. Mediterranean diet right now. That's all easily
Yeah.
accessible online.
Yes, the blue zone is good too. Yeah, that's just how to live that blue zone.
Right,
People know what that is. Yeah, that's a
right.
very cool
Yeah,
thing.
we've
You know.
talked about that. And also Mom's Meals. Do you know about that, Dr. Raymar? That's an
No.
online meal delivery service that's you can get, if you have Medicare and partnership, you can get them to pay for the service for a certain period of time. And it's even delivered up here in the Northland. So that's an accessible thing. Providers, so what's in my mind is that what kind of somebody who's pre-diabetic expect from their provider in terms of routine care? You know, if
Okay,
they,
well, first of all, they would want to ask a lot of questions.
sure,
It's really important that they feel well informed, and if the provider, whatever they are, says, "Oh, you've got prediabetes," and then
right,
they sort of go on and say, "Hey, what is my A1C number? Exactly where am
right,
I? And
right,
what are the specific steps you can do?" And if you have prediabetes, there's actually some pretty specific things that we prescribe that 150 minutes a week, and we try to work with people on maybe perhaps some modest weight reduction activities, but I try not to focus too much on weight reduction, but rather healthy eating. And then if
yeah,
you naturally lose some weight,
right,
that's
exactly.
the better way to look at it. I don't like focusing on, oh, you got to lose some weight, because that's a horrible message to
Oh
people,
yeah,
and usually,
and then they click off at that point. Yeah, and
right,
there's
right.
too much shame around that.
Yes, it's really bad.
So I
Remember that with your daughter later when you.
oh zing. So and I imagine hemoglobin A1C, maybe lipids done at a reasonable periodicity, and
Yeah,
yeah,
they would want to have their A1C repeated, usually about a year at the most, but they may want to, if you do those interventions, they may want to go in 6 months and say, hey, are things looking better, and get that feedback. And
right,
we would work with people on that. And, on occasion, a medication to do prevention might be important. There are certain situations, like a gestational diabetes patient, and had that, and in the first 5 years, if she has prediabetes, we may offer them metformin as a prevention. Or for somebody who has more limited physical capabilities, they might not be able to achieve that 150 minutes. It's a collaborative conversation. You just offer these things, but everybody should have some lifestyle discussion, and once they get prediabetes. About a little over 1/3 of all adults in the United States have prediabetes, so it's a huge issue.
So, Dr. Raymar, we have 2 minutes left. It's hard to believe. Is there anything that you want to say right now that hasn't come up already? What wise words can you leave us with?
I don't think anything really new, but just to reiterate that people should know that at whatever stage they are in their life, there's things that they can do to improve their health, and not to be despairing. Say, oh, I already got prediabetes, so I'm going to get diabetes in a few years. No, don't focus on that. Focus on being healthier and doing the things that you can, that you have control over. There's things we don't have control over. We didn't talk about smoking, but people who smoke are at increased risk for diabetes. So that's some low-hanging fruit. It's simple but not easy, right? People should not smoke for many reasons, but it's a hard thing to stop. I used to smoke; it was really hard stopping. And so you would want to work on that as well. So just basics, sleep, not smoking, looking at your nutrition, and trying to improve your activity. Remember, when you increase your activity, to do it gradually. Don't go from 0 to 150 minutes in a week. You want to gradually build up in a way that's easy for your body.
Absolutely. Well, this has been such a great conversation, Dr. Raymar. We so appreciate your input here, especially for this community that is challenged by so many things. I just want to say thank you.
Pleasure.
Yeah, thank you for
Sure.
your participation today. And hopefully we'll have you on again. We'll think of another topic. You can't retire so quickly. So.
Yeah, and I appreciate Paul's very beautiful summary of what I was trying to say there about the lifestyle changes. So that was great.
Yeah, absolutely.
Well, thank you, Dr. Terry Raymar, our guest today on this week's Health Matters. And Lynn, any thoughts about next week?
We're going to talk about postcoital contraception.
Okay.
Or the Plan B.
All right.
Okay.
All right. That's it for this week's Health Matters. Lynn, thank you.
Thank you.